Good evening, everyone, and welcome to another edition of the Lympha Press Educational Webinar Series. We try to mix things up every now and then. Sometimes we do lunchtime webinars, and sometimes we do early evening after people have had dinner, because we know that there's a lot of interest around tonight's topic. And the reason we know is we did a Google search on exercises for lymphedema, and very little came up. But we realized it was something people were really searching for. So we said, well, let's create some content around this. So I asked my friend Kathleen, listen, who should we invite to host this webinar? And she said, hands down, Lisa Sylvestri. And we are so honored to have you with us today. She is going to talk about muscle pump activity. How does lymph move? She's going to be talking about exercising with lymphedema. And she is a concierge physical therapist who really is devoted to wellness, well-being, and wellness. And she focuses on lymphedema patients. She is an expert in oncology. We at Lympha Press are so honored to have her with us today. Lisa, and you are in California, aren't you?
I am near the Bay Area, yes.
How lovely. Well, we know it's a little earlier for you. We already have 45 people that have logged on. We want to encourage you to please let us know you're here in chat. Put your questions in the Q&A and we will answer them at the end. This webinar is being recorded by Lympha Press. There is one section that we wanted to show a video, and unfortunately, because of technical difficulties, it wouldn't play. I'm going to put that link in chat so you can grab it. And then the recorded version will have that so that you can watch it for the replay, which you will all get a link to after the fact. But without further ado, I'm going to disappear. And thank you, Lisa, for presenting. I'm all ears, and so is everyone else. Take it away.
Awesome. Well, thank you, Brenda, so much for inviting me to speak. And thank you to Lympha Press for having me. I am thrilled to be here, and I am thrilled to get started and talk about lymphedema and exercise. So without further ado, here we go. Oh, maybe. There we go. So what actually is lymphedema? I'm sure most of you who are logged on already know, but it is a high protein fluid accumulation within a body part. It's really important to understand that this is not just water accumulating in an area, but the high protein fluid that makes up lymphatic fluid, and that is what lymphedema is. We get it because of a dysfunction to our lymphatic system as a whole. Lymphedema is usually broken down into a primary cause and a secondary cause. Primary lymphedema is usually due to a congenital or a hereditary problem. And secondary lymphedema is due to a dysfunction or interruption of the lymphatic system, most often due to surgery, trauma, radiation, and things of that nature. I'll get it, I promise. When we talk about lymphedema, there are 4 stages: stage 0, stage 1, stage 2, and stage 3. As we progress through the stages, the lymphedema is progressing in nature. Now, I think that most of you know, when you realize you have lymphedema, the earlier you start treatment, including exercise, the more effective the treatment usually is. What I really, really want to get across today is that even when you are at stage 0, so you have a known trauma to your system, you've had a oncology surgery, you know that you have a history of primary lymphedema in your family, you may be seeing only mild or minor symptoms, so a stage 1. The earlier you start with your complete decongestive therapy, including exercise, the more beneficial the treatment will be. So even if you start with just some light walking or some basic exercises, it's really going to be effective in treating your condition. Okay, so when we talk about exercise, what are we actually talking about? We're talking about any physical activity that maintains or enhances our physical fitness, as well as our overall health and wellness. There are usually four main components that make up exercise: aerobic training or aerobic activity, resistance training, so lifting weights, balance training, and flexibility. It's really important that all four of these aspects are included in an exercise program, and that when you're performing your exercise program, you're doing enough activity to actually increase your heart rate and make a difference in your body. So how does lymph flow? Lymph is, like I said, a high protein edema that travels through a very complex network of vessels towards regional lymph nodes, and eventually it always travels up towards the terminus. Now you can see in these little squares, the terminus is the end or the terminal point of our lymphatic system. The lymphatic system ends at the junction of the right and left internal jugular veins, as well as the subclavian vein. So this is a really nice picture. The lymphatic system is a completely separate system from our blood circulatory system. However, they both wind up working together and coming together at the end. So a backup in one will often result in a backup of the other. We need them both to be working efficiently. What we don't see in this picture are regional lymph nodes. So we're always traveling up towards the heart, towards the terminus, or if you're talking about the head, traveling down towards the terminus. We're talking about the body today. The lymph nodes gather in four main areas. Those are the armpits, the groin area, our abdomen, where our internal organs are, as well as our head and neck. So four main areas. It is always going to flow to the regional lymph nodes. So from your legs into your lymph nodes in your groin, or your inguinal lymph nodes, from your trunk, either down towards the lymph nodes in the groin or up towards the axillary lymph nodes in our armpits. And then everything will flow deeply into that main large green vessel you see on your screen called our thoracic duct. There are actually two thoracic ducts, a right and a left, which will travel into that terminus area. So all flow is moving in one direction towards these two spots at the end of the system. Now we have to understand how lymph flows. We understand where it's flowing, but how does it flow? Well, lymphatic flow is mostly passive, which means it's going to happen whether or not we're working at it or whether or not we're thinking about it. When there is a lymphedema, lymphatic flow is significantly decreased. But again, in normal circumstances, lymph will move by pressure differentials within our body, which draw the lymphatic fluid into our lymphatic system at the beginning. The lymphatic vessels have smooth muscle within them so that they contract along the vessel in order to make that lymph flow in one direction. The lymph vessels do have valves in order to promote that fluid flow in only one direction and to prevent backflow. And nearby pulsation of arteries and veins will also help promote lymph flow in only one direction. So I'm going to talk about this briefly in a moment, but when you have your lymphatic vessels, and I'm talking about pumping down the length of the vessel, the area between one set of lymphatic valves and the next set of lymphatic valves is called a lymphangion. And each lymphangion has a lot of smooth muscle in it, and it is strongest right in the middle section between those two valves. So the muscle contraction is strongest there, really helping push that lymph fluid out of that area and beyond those valves to prevent backflow. When our when our vessels get full of fluid and we get really swollen, the vessels begin to distend and the valves no longer close appropriately. So you get that backflow. And that's why we need to exercise and get our muscles and surrounding tissue to work harder to close that vessel and to pump even more pressure so that that valve and those vessels can get back to their normal size and help promote that flow to return to normal as much as possible. So how do we exercise appropriately? The first and most important exercise we can do is diaphragmatic breathing, and I'll get more into that in just a moment. And we can also use our muscle pump activation. So think about that as each and every muscle within our body works effectively at contracting. The more we exercise, the more we train our muscles to work more efficiently, to work harder, and to more effectively pump fluid out of an area. And we'll talk again about muscle pump activation as we go through as well. So it's also important to note that we have both superficial and deep lymphatics. Our superficial lymphatics begin in our epidermis and dermis, and they travel just beneath our skin within that subcutaneous fatty tissue that we all have. Our deep lymphatic system travels deep within our thorax and our abdomen into our internal organs, around our GI tract, our deeper blood vessels. And there is separation between our superficial system and our deep system, and it's usually separated by our fascial layer, which runs throughout the entire length of our body. But there are some connections between our superficial and our deep lymphatics by what we call perforating vessels. The end of a long day here, as it is for you. Forgive me for tripping up a little bit. These perforating vessels are important to understand because when we contract our muscles, they are mostly lying superficially. And the more we can help them contract, that will also impact these perforating vessels and affect our deep system as well, and vice versa. So the more we can actively pump our lymphatics, the better our whole system will be and the better our whole system will work. So here is the video that we don't have. Brenda will put a link in it. It's a 52-second video from Medi USA, and it shows our venous system. I do encourage you all to take 1 minute and watch this video because it has a great representation of how our muscles contract to help pump venous fluid and how the vessels and the valves work to prevent backflow of our venous blood. It is a very, very similar concept to what we are talking about with our lymphatics. So again, I encourage you to watch this quick 52-second video when you have a moment. So now let's talk a little bit more about our diaphragm muscle. You can see on this left figure that our diaphragm muscle starts at the lower aspect of our rib cage. It also connects back to our lumbar spine, and it even has a deep connection because when we breathe, and I'll show you how it works, it's going to have connections into our pelvic floor. So this is a very, very important muscle to work and to train in order to get better motion of our core musculature, as well as impacting lymphatic flow. So now you can see on the diagram on the right that our major lymphatic vessel, that thoracic duct, actually perforates the backside of the diaphragm muscle. So I'm going to back up and stand up a little bit so you can see, here's my rib cage, and here's our diaphragm muscle underneath. As we do diaphragm breathing, and we'll do this together in a minute, when we breathe in, our abdomen expands, our diaphragm goes down and out to increase the size of the abdominal cavity. And then as we exhale, it raises back up and in. So it's this movement out and in within our abdominal cavity, and this creates a bit of a negative pressure. And this pressure will act almost as a suction for all of the fluid coming up through that thoracic duct, creating more pressure and helping our lymphatic flow up towards terminus. So it's a very, very important concept to understand that when your therapist or someone is talking to you about diaphragm breathing, we can train this muscle to work better, and it will have a direct impact on our lymphatic flow. So I really, really want everybody to understand the importance of diaphragm breathing and diaphragm activity with lymphatic flow. So as I just said, when we inhale, our diaphragm flattens and allows our rib cage and abdominal cavity to expand. And as we exhale, comes up, our diaphragm elevates in the center and the ribs return to normal. So we get this fluid flow and that negative pressure. So now I hope you will all join me in doing a diaphragmatic breathing exercise. So you can do this lying down, you can do this sitting comfortably. I invite you all to put one hand on your chest and one hand on your abdomen. Now, sometimes this is called belly breathing because we feel our belly moving. If you understand that it's the diaphragm muscle, and no matter what we do, oxygen is always going into our lungs. But I want you to almost emphasize this movement so that you can feel the expansion and contraction of your abdominal cavity. So first, just start with a few nice, relaxed breaths. Feel the rise and fall of your chest, and try and notice if you feel that rise and fall of your abdomen as well. Now for your next inhalation, focus on breathing in and bringing all the air into your belly. So let your belly protrude out as far as you can. And slowly exhale and feel your abdomen go in. Your chest is likely still going to rise and fall, but I want you to feel the abdomen moving more. Now do that slowly another few times. Breathe in, fill the abdomen with air. And exhale, empty all of the air from your abdomen. As you do this, you should be able to do it a little bit more slowly and more controlled. Holding an extra second or two for the inhalation and then the exhalation. And this is something that you can practice every day in order to strengthen your diaphragm muscle. This is an exercise I give every patient almost always on their initial evaluation or the very first time I see them. And I explain why we're doing this. There are other benefits to understand as well. But before I tell you that, I want you to understand that because we're breathing in oxygen a little bit differently, it's still going into our lungs, but it is not uncommon to feel a little bit lightheaded and dizzy because, again, we're bringing in oxygen a little bit differently. I want you to stop immediately. The more you do this and the better you train your body, the easier this will get and the less lightheaded and dizziness you will experience. So for each patient, I write differently. Start with just 1 or 2 breaths and then eventually build up to 3 to 5. If you're a very experienced yogi, for example, a lot of yoga breathing is very similar and common to diaphragm breathing. You might be able to do 10 or 20 breaths without feeling dizzy. If you are doing this laying down or reclined, you may get even more dizzy upon sitting right away. So just stay in that seated position for an extra moment before you attempt to get up. Your breathing, your blood pressure, everything needs to return back to normal. One of the other wonderful benefits of diaphragm breathing that I told you I wanted to mention is that there are direct nerve connections from our diaphragm that affect our nervous system. So you've all heard of your fight or flight as you get excited and agitated. The very opposite is our parasympathetic nervous system, which is our rest and digest system. Diaphragm breathing helps to stimulate our parasympathetic nervous system and helps our body heal. If you are dealing with trauma, if you are dealing with stress, if you are dealing with muscle injury, not only are you exercising your diaphragm muscle by doing this, but you are also helping your body heal. This is a wonderful exercise for everyone to learn and practice and perform daily. This is my favorite exercise to teach because there are so many valuable benefits to this one exercise that everybody can benefit from. So now I want to talk a little bit specifically about the research that exercise and lymphedema has in common. Now, it's really, really important to understand that the large majority of research that is out there on lymphedema is on breast cancer. So I worked really hard to find a variety of articles that had some different information, but I still think that this study from 2009 is one of the most important that we can all look at and understand so we can better realize just how important and beneficial exercise is. So the PAL trial is from 2009. It was led by Dr. Catherine Schmitz, and it is PAL, P-A-L, Physical Activity and Lymphedema. This was a randomized controlled trial with almost 300 breast cancer patient participants who had lymphedema or were at risk for lymphedema at the start of the study. For this study, risk of lymphedema meant that 2 or more lymph nodes were removed. There was a 12-week exercise program where patients were put into a supervised exercise routine. The exercise routine consisted of aerobic training, strength training, and flexibility training. Each session was about 1 hour long. And then after this initial 12-week session, patients were asked to maintain the exercises independently on their own. So they were no longer supervised, but they all stated that they continued to perform the exercises as given. Lymphedema was considered a 5% increase in the affected arm for this study. And what they found was twofold. So in patients who were at risk of lymphedema, strength training did not increase the risk of getting lymphedema in the affected arm. They also found that a slow, progressive weight training regimen actually resulted in a decreased incidence of exacerbations for those patients who had lymphedema. And they also had overall reduced symptoms of heaviness and discomfort. And of course, they showed increased strength. So when I first became a lymphedema therapist about 15 years ago in 2008, I still had a whole bunch of patients who came to me and said, oh, nope, I just had breast cancer surgery and my doctor told me I can never lift more than 5 pounds again. This is the study that literally changed the pendulum, changed the way that we think as therapists and medical practitioners. Not only is it not dangerous, but it is so beneficial to exercise for a whole host of reasons. But for lymphedema specifically, we are going to potentially prevent it. And if you've already gotten lymphedema, we are going to help improve your symptoms and make it better. So this was the first and still one of the most talked about trials that has changed the way we think and has now been proven 2022, that's 13 years later, changed the way we think about exercise. It's not only safe and okay to do, it is recommended. Every patient with lymphedema should be doing some sort of exercise. Okay, so this next study is looking at the immediate effects of active exercise with compression therapy on lower limb lymphedema. So this was, I believe this was also in oncology patients. I'm trying to look really quickly. We gotta go back. Doesn't say here. This was a more recent study. It was a smaller study with 23 patients, and they all performed 15 minutes of exercise on a bicycle ergometer, so a recumbent bike, at either a high load, a low load, or they were sitting at rest. And each bout of exercise was separated by a 1-week washout period, which means they were doing no activity whatsoever, aside from their normal daily routine. The intensity of the exercise was determined to be 10% or 5% of the patient's maximum exertion, and they were told to stay at 50 RPMs, rotations per minute, for 15 minutes. The patients who were given compression therapy, they were using compression bandages, and they were measured to be at 40 millimeters of mercury in the bandages. So it's just important to see that compression, the volume decreased significantly between all 3 interventions, and that the volume was the best reduction with active compression and active exercise and compression. I'm sorry, someone is knocking on my door and they're not going away, so I'm trying to ignore that. Active exercise with compression is the most effective at reducing lower lymphedema at the same time. Okay, next slide. And finally, early prevention of complex decongestive therapy and rehabilitation exercise for prevention of lower extremity lymphedema after gynecological cancer. It's Gynecological Cancer Awareness Month, and it's important to know that the research for gynecological cancers, again, still oncology patients with lymphedema, but there is a growing awareness of the need for this research, and we are starting to see the benefits of exercise with lymphedema in the gynecological cancer patient populations as well. So this was patients who had endometrial and cervical cancers. And I want to mention that treatment for this study began the day after surgery. So it was 109 female patients, and there was a control group who only received the standard complete decongestive therapy. So CDT for this study was 40 minutes of MLD, manual lymph drainage, with bandaging, and this lasted for 40 days. Everyone also received education and skincare. But the exercise group had basic bed exercises of leg lifts and range of motion exercises and ankle range of motion exercises. So very basic once they were ambulatory and able to get up and walk, usually within the first few days. They also included some standing exercise. There was no machines utilized. There were no leg weights utilized. It was simply body weight exercise. So early prevention combined with rehab exercise reduced the incidence of lower limb lymphedema significantly, as well as improving patients' quality of life and reducing cancer-related fatigue, which is another huge issue that many oncology patients have to deal with. So again, we consider complete decongestive therapy the standard of care. So having the lymphatic drainage, having the compression either with bandaging or with garments, but adding in the exercise component is making these treatments even more effective for patients across the board. Again, these are all oncology patients, but I think it's safe to say that if we can apply this information to our primary lymphedema patients, we will hopefully see similar results. So in the studies that we're looking at, there is usually a combination of aerobic training, strength training, as well as flexibility training. Starting with body weight. You don't have to use the big heavy machines, and you have to figure out what you love to do. When it comes to flexibility, we don't all love to take yoga classes. We don't all love to sit on the floor and stretch our legs and stretch our hamstrings. But if we're talking about muscle pump activity, and we have a muscle that the more we strengthen it, the more effectively it pumps, and the more effectively it will help move lymphatic fluid, we have to consider the flexibility component as well. If a muscle is always strengthened and exercised and pumping more effectively, it may get larger, but it may also shorten. So muscles are attached on either end to bones, and the stronger it gets, there may be a little bit more tightness. Again, the muscle might be working more effectively, but it's getting tighter potentially in the process. We have to focus on slow, effective stretching exercises in order to best maintain the length of the muscle fibers so that they will continue to work as optimally as possible throughout the entire range of motion that that muscle offers. Also, if you have a very tight, hardened muscle, the lymph vessels that flow around and within that muscle will meet resistance. When the muscle is soft and pliable and flexible, fluid flows more easily around and through it. So do not ignore the stretching component of your exercise routine. If you love running and you love going for a walk, make sure you start slow. And then at the end of the walk, make sure that you're doing some calf stretches, some quadricep and some hamstring stretches. Make sure you incorporate that 5-minute cool down and flexibility training. If you love going to the gym and at the complete opposite end of the spectrum, you're into CrossFit. Number one, it may take you a while to build up to that level, but it is absolutely possible to exercise and work out at a very high level, competitive level even, with lymphedema. You can train your muscles to pump effectively, to manage the fluid, but to continue to make you strong and healthy and achieve those high impact exercises without flaring up your lymphedema. It is a training process. I wouldn't recommend trying that if you haven't done anything similar to it in a long time. But if you slowly have a goal to build up to that level, it is absolutely possible. Find a combination, walking with, more high intensity spurts, interval training. On a couple of days, do some walking or swimming, which we'll talk about in just a moment. And then on other days, do some more high level weight training, weightlifting. Find what you love. Try a yoga class. Incorporate the deep breathing. The mindful side of a yoga class is also healing for our entire body, but that's a different discussion. It is all exercise. It is working your body in a variety of different ways. I think it's really important to try and utilize as many aspects as you can that work for you, because they are all going to be very beneficial. Okay, so let's talk about exercise and then the pool specifically. You always want to start low and progress slow. This is a process. It is not a race to the finish. Find something that you are going to do and maintain throughout your life. It has to be a process. If you go into something trying a class that your friend goes to, but it's too hard for you and you're hurting, but you push through, you're going to set yourself back. You're going to cause more inflammation in your muscles, in your body, make fluid build up worse, and you're going to say, that's not for me. Never push yourself to the point where you feel like you can't continue. Never push yourself to the point of pain. I personally don't believe in no pain, no gain. That doesn't mean you won't feel it the next day. Please remember, a little bit of soreness is okay, But if you're pushing yourself to a point where, ooh, that doesn't feel right, it's not right. It's not right. It's always important to incorporate, and I think it's good to start with core exercises. You cannot do anything if you have a weak, floppy core. You need strong muscles to maintain a nice, tall posture. You need tall muscles to engage your abdominal muscles for lifting. You should be able to tighten your core muscles and still breathe and still lift a weight all at the same time. Only after you get the understanding and the basics of core stability should you really start with true weightlifting. This is my theory, my belief. Not everybody has the same beliefs that I do, but I think it's really important to at least understand how to engage your core before you start doing another sort of weightlifting or weight training program. Excuse me. Now let's talk about aquatic exercise. Okay. This is a portion of an amazing article that I read, and you have the reference here, talking about the pressure of water. So something I've been asked many times is, well, just how much pressure am I getting when I'm working out in the water? So water exerts a pressure of 22.4 millimeters of mercury per foot of water depth. So if you're in water 4 feet deep, this means at the deepest area by your feet, you will have close to 89 millimeters of mercury of pressure. So for those of you who have ever said, I don't think I can tolerate anything more than a 20-30 compression garment, or there is no way I'm going to be able to wear a 30-40 or a 40-50 garment, no way. Getting it on is one thing, but once you get it on, I guarantee that you will be able to utilize that pressure to your advantage for a workout and for a comfortable experience. The more pressure you can tolerate, the better you can control your lymphedema, and the more pressure your muscles are exerting outward into the water and the water's pressing back, it will give you a more effective muscle pump and muscle pump activity and exercise regimen in the water. The rest of this article is just as interesting as this part, but I only wanted to show this one part. This is something we've known for a long time. If you can get into deeper water and float on a noodle and you're taller than 4 feet, you're going to get even more pressure in your feet if you just do some kicks and do some movement, legs forward, legs to the side, leg circles, figure eights. If you have upper extremity lymphedema and you can get or squat so that you are up to your neck in water, you're going to get 2-3 feet of pressure on your arms. So you're going to get over 60 millimeters of mercury of pressure, if my math is correct. Start with fingers, wrists, hands, arms, circles. Everything that you can do in the water is going to be easier because you're less weighted in the water, and it is more effective because you have such a strong compression all around you. There was a study in 2016 that was looking at exercise to reduce chronic lower limb edema. This was a very small study of 16 patients who had chronic venous insufficiency. So a different type, not a secondary lymphedema due to cancer. So this study was looking at exercise in water versus dry land. And the results showed that it was positively impacting chronic leg swelling, offering aquatic therapy as a first line of rehabilitation for this medical condition. Lower limb volume decreased significantly, ankle range of motion improved, and people felt better. If you feel better and you have better range of motion and your leg is less heavy because there's less fluid in it, you are probably walking better. You are probably walking longer on land. You are able to have a better exercise routine because of the exercises you are doing in the water. This really can't be emphasized enough. This is such a great type of exercise. So now I want to show you an exercise that exercise study, that was done last year by Dr. Wei Chen and his team. Exercise enhanced ICG lymphography. So diagnosis and staging of lymphedema with ICG testing during exercise. So there were only 9 patients, but 23 limbs were evaluated in this study, patients with upper extremity or lower extremity secondary lymphedema. So it was comparing this to previous tests which use ICG and that are about 6 hours in length from time of injection to looking at the results. And then over time, it was realized that manual lymphatic drainage can speed up the timing of ICG, but how much faster could it get with actual exercise? So after they were injected with the dye, they performed 5 minutes of exercise 3 times, so a total of 15 minutes of exercise on a recumbent cross trainer using all 4 limbs. So arms and legs are moving. They maintained an RPE rate of perceived exertion, level 12 to 13 out of 20 for the scale that they used, which equaled a light to somewhat hard activity level. And ICG readings were utilized immediately and at plateau. And they found that plateau was reached after 15 minutes of exercise. So this was significantly improved over the initial studies where patients were laying or just in a room and it took 6 hours to reach plateau, or where they were using MLD, or even sometimes they were using treadmill walking, just the legs alone, which sped up that timing. But it was not even close to plateau within 15 minutes. So this is just more proof that exercise is helping our lymphatic flow much more effectively when we are exercising and when we are moving our muscles. Okay, so this slide is really just stating how difficult it is to find clinical data looking at primary lymphedema versus secondary lymphedema. All of the studies were looking at patients with a secondary lymphedema. When we're talking about any exercise program, whether you have a history of cancer, surgical history, primary, secondary, it is always important to get medical clearance from your physician to begin an exercise program. I can't state that enough. You must be safe enough to learn the exercise program, and then your team, including a physical therapist, can help you figure out what your exercise routine is going to look like. And it's always very beneficial if you have lymphedema to wear your compression garment. I think that if you are someone who has a stage 0 lymphedema, you should very closely monitor your symptoms because, like I said in that PAL trial, patients who did not have lymphedema did not wear a compression garment, and they had much fewer patients who actually got lymphedema. On the flip side of that statement, as a lymphedema therapist, I do think it's important that you're fit if you are a stage 0 for a proper fitting garment, so that at the first sign or feeling that you may be getting heaviness in a limb or you might be feeling different, you have that compression garment to wear right away so that you can actually potentially prevent those symptoms from getting worse and prevent that flare up from becoming a true lymphedema. So considerations based on the information that I've just given you. It doesn't matter if you have primary or secondary lymphedema. Exercise is going to make your muscles work more efficiently, and it's therefore going to help your lymphatic fluid flow more efficiently. Start low, progress slow. That's something I say a lot in my practice. Start with what you might be able to do. If you are a cancer patient and you're going through chemo and you're having a terrible day, you might only be able to walk 1 lap in your hallway. Good for you. that is great. That is a wonderful place to start if that is what you can get done. If you are someone who has always been very active and you are looking to get back into that CrossFit program, just start slowly. After each bout of exercise, as you are starting your program, wait 1 or 2 days in between workouts to see how your body responds. 24 hours after exercise, you might feel a little bit of that muscle soreness, but you don't want to exercise again that day at the beginning until you see how your body responds. Is that little bit of soreness going to get better the next day, or is it going to get worse and cause severe or significant muscle problems? Wait to see how you respond, and wait to make sure you have no symptoms for usually 1 to 2 to even 3 workouts before you increase your weight, increase your intensity. You can get to that high level class. It just might take you a few weeks or potentially even a few months. Again, so no pain, no gain. A little bit of soreness is okay. Anything beyond, ooh, Lisa gave me a good workout, might be a little bit too much to start. Inflammation in the muscle can set off a lymphatic exacerbation. The type of compression you utilize doesn't necessarily matter, but we are showing that using the compression with exercise is better. If you like bandages, or if you're in the bandaging acute stage of lymphedema treatment, great. If you are in compression garments, if you have a variety of strengths of garment, try and exercise in your stronger garment. The kind of compression isn't going to impact the, is there a benefit or isn't there, but you may see better benefits with the stronger compression. As we showed in some of these studies, exercises can be performed lying down, just doing some basic leg lifts. It can be performed walking on a recumbent exercise trainer, a bike, or an elliptical. Consider the weather. Things that we are known to cause inflammation are sunburns. So always put your sunscreen on. You don't want to create more inflammation in a limb that might have lymphedema. Bug bites. And I say this because I've seen it. Someone was out hiking and got a whole bunch of bug bites on her affected arm, and that created an exacerbation. So if you love to exercise outdoors and it's getting buggy, or it's hot and muggy where you are, put your bug spray on. Wear long pants, wear long sleeves to protect the limb from, again, a hike, a rogue branch, or something that can scratch you. Make sure you're wearing good shoe wear, especially if you're a lower extremity lymphedema patient. And when you take off your shoes, examine your feet, make sure there's no red pressure spots or blisters or things like that. Anything that's going to make your exercise workout easier and better is going to be important. You want to make sure you're not hurting yourself along the way. Special considerations for patients with cancer. Any exercise is good to start with. Do what you enjoy. Again, it might be 5 minutes getting fresh air. It might be, going to an exercise class. Wherever your passion lays, that's what I want to get you back to. So where you are in treatment will certainly determine what you're able to do. If you're just post-surgical, you might have some specific restrictions. If your doctor says don't lift overhead, but you can work out below 90 degrees, you can still do diaphragm breathing. You can still do some core exercises. You can do some postural exercises, things like that. If you're in chemo, you're going to have to monitor your fatigue and pick a certain day of your cycle or week where you can exercise more effectively than others. If you've had radiation, there are a significant amount of problems that might occur on your skin. You could have fibrosis, which is hardening, which will impact your range of motion and perhaps your muscle flexibility as well. You may have restrictions of going into a chlorinated pool at that time. Just know what your what your restrictions are, and your team can help you work around them. So what is a really good exercise routine to do? Well, start with a 5-minute warm-up if you can. If it's 2 minutes, that's great too. Go for a walk. Do some marching in place. If you're sitting, you can't see my feet, I'm just marching in my chair. Arm swinging adds a little bit more to that aerobic capacity. Begin with core or central exercises. Slowly incorporate your diaphragm breaths. just sitting here, if I say engage your core, pull your belly button up and in without moving your spine, you're going to feel the engaging of your transverse abdominis muscle, which is a key postural muscle. That's a great exercise to start with. Then start with your postural, your shoulder blade muscles. Shoulders roll back. And now feel your shoulder blades working and squeeze them together. Squeeze them together. And slowly work your way outward. So now do some shoulder exercises. Raise up and down, out to the sides. I'm not using any weight. You can feel the warmth starting to build in your shoulder blade areas, in your shoulders. Circles. Arms, full arms or half arms. If your full arm is too heavy or too hard, half arms. Go to your elbows, some biceps. And then you can lean forward, straighten your arms, and activate your triceps. If you're doing this in a slow, conscious manner, you don't need resistance if you're just starting. So that was obviously working the upper body. If you're doing the lower body, start with your marching. Start with your breathing and your core exercises. Start, again, you can't see my legs, just march in place. Get the hips moving. Move your legs out and in, out and in. You could do a squat. You can do in your chair just some knee extensions, foot out and in. Feet on the floor, raise your heels up, then raise your toes up. That is exercise. That is a basic exercise routine. So I never let a patient tell me I can't exercise. You can. You can all do it. Start low, progress slowly, find what you love, figure out how it's going to work for you. 10 minutes here and 10 minutes there is wonderful. The more you train these muscles, the more efficiently your lymph will flow. It will help in the management of your lymphedema, no matter what stage you are in. Wear your compression and follow the advice of your medical team. I want to open up the floor to questions. I invite emails, calls, anything like that. I want to know what you all think.
There is a lot of people thinking a lot of things, but most of all, they're saying thank you because this presentation was so needed. I almost feel like it's a must-watch webinar for anyone with lymphedema. It really was a primer walking us through so many different things. And there were a lot of questions. One that kept coming up, and I think you mentioned this, but let's clarify. Can you wear compression while you are exercising or even swimming?
Absolutely. And if you have lymphedema, you definitely want to wear your compression while exercising. If you don't have lymphedema, that's where the jury is still out a little bit. I think if you're stage 0 lymphedema, that is still considered having lymphedema. I know not everybody agrees with me. So try exercising in your garment. If you don't wear your garment, but you're noticing a heaviness, a feeling of pressure after your exercise, make sure you at least have a garment and put it on after. I love when patients tell me they go in the pool, and especially if they wear their compression garment. I usually recommend wear one of your older garments or buy a spare garment because the chlorine will affect the efficacy of the material after a while, and it will not be the same, but wearing your compression in the pool or in the water is awesome.
And there were also questions, one from my colleague, Alexa Ercolano from the Lymphy Life, and also for marketing at Lymphopress, about sitting at your desk all day long. And
hi, Alexa. Hi, everybody. Sitting at your desk all day is a bummer. What I tell my patients to do is set a timer, either on your computer, on your smartphone, and make sure you get up at least every half hour. If you work from home, which a lot of people still do, if you're in an office, use it as an excuse to go fill your water and stay hydrated. Just do a lap around the office or the house. It's not enough in the grand scheme to get up for a minute or 2 minutes. Ideally, if you could get up for 5 minutes, do a few squats, do a few heel raises, just get the blood flowing. that will be better. The more you sit, the less flexible and the less mobility and the less fluid flow you're going to have in your rear end and in your hamstring area. So you really want to focus on exercising and stretching those areas when you're not in your chair. But a lot of people have jobs where we're sitting at computers all day. So just get up as often as you are able to.
And that goes for everyone. I need
that goes for everyone
too. I absolutely do. I was listening and learning. I don't have lymphedema, but I talk to lymphedema patients all day long and lipedema patients as well. And my heart just wrenched to think that prior to 2009, people were advised not to move.
Yeah, I think that, thank goodness that someone started to look at the research and say, is it really bad for us to exercise? And now there has been, again, mostly in the oncology patient population, but there are an abundance of studies looking at cancer patients and exercise and the benefits of exercise for lymphedema and for lipedema as well. The more we move, the more fluid flows, the better off we will be. I mean, and, alongside that, the PAL trial, there is so much evidence now that exercise helps reduce the risk of cancer and chronic illness in so many different types of people and patients. So, you're talking to an exercise specialist and a physical therapist, they're always going to tell you to move, but it is so beneficial. It is so just good for your health to move.
And I hear the voices of people saying, but I can't. And I get that. And I think, of course, I represent Lymphopress, which is pneumatic compression therapy. You mentioned the higher pressures not being a problem, but there can be challenges pulling on compression garments. What's so wonderful, and I have to say this about the Lymphopress, is that it's so easy to use. You just put it on, zip it up, and the air fills to fit your limb and helps to get that pumping action, the lymph flowing. So I do want to say, if anybody out there, and I see a lot of new names I haven't seen before, if you want to know more about Lymphopress and how that might be able to help you, please shoot us an email. I'll give you our email address, marketing@lymphopress.com. And that includes Alexa Urcolano, who is a lymphedema patient, which has really helped to inform some of the decisions we make at marketing at Lymphopress, because she really understands the lymphedema community and we truly care. So I wanted to put that out there. I'm so glad you mentioned the point about pressure. We have a question from India Reynolds. She has patients with phlebolymphedema report that they have increased swelling after being in the pool. This is consistent with her wound care training to educate venous insufficiency patients not to soak their limbs in water, as it is known to increase their swelling. She wanted to confirm in this question and in this comment that the study you mentioned in relation to aquatic therapy was for venous insufficiency patients. And if so, do you have an explanation as to why this is not a problem for phlebolymphedema patients?
I am not a wound care specialist and I did not know that. So thank you, because I'm going to look it up. I do have a list of references here with all of the information so you can look up the study. It was on chronic venous insufficiency patients. It was a small sample size. So I unfortunately can't really give any more information on why you might be hearing that. I can't say for or against. I just don't know.
Well, I think that that is always the best answer, and there's no harm or foul in saying that. And we'll certainly dig into that. We certainly appreciate the question. In fact,
absolutely,
I do want to say we have had an amazing audience tonight. They are so open and receptive, and they are asking the best questions. Leora Comis asks, for lower extremity lymphedema, do you advise after diaphragmatic breathing to begin with movements of the trunk before proceeding to the hips?
I typically do. I do think it's better, and I said, to have that core stability. So trunk exercises are a part of core stability for sure. I think a lot of people forget core exercises and they just want to get into their exercise program. But if you think about what I said, just engage the core, think about pulling your belly button up and in and being able to hold that while you're doing your other exercises. That's at least one place where you can start. So I do think it's a good idea to have a basic few core exercises that you and your team decide on that work for you. Before you move on to the hips or the legs. But even if you just remember to engage the core every time, so you're not arching your back and potentially causing any back problems or other problems, it's very important to do that.
Excellent. You know, we have a mix of both patients and practitioners in our audience tonight, and I love the mix of questions.
Yes.
Hannah Weintraub is out there, and she is a lymphedema therapist. She says, when it comes to diaphragmatic breathing, you're going to love this. I will tell my patients who are having difficulty, especially by CHF patients, that it's the same as laughing a lot. I tell them to put a comedy on every day and just laugh.
I love it. I love it. That's great. It's true. And you, I mean, I can't tell how many times I've done that in the clinic and wondering who's laughing at me on the other side of this door today. Yes. Laughing is excellent. Laughing is the best medicine, right? So I totally agree with that.
We are simpatico here.
Yes.
So Cindy Felix says, what do you recommend for those of us that can't use compression? She has degenerative arthritis and very limited mobility. We feel for you, Cindy. And she says next month she's having a complete hip replacement. Recommendation?
Definitely elevation, pneumatic compression. If you can't get a garment on, I mean, like Brenda was saying, pneumatic compression is an amazing tool to use. And I'm an advocate for it, especially if nothing else is going to work for you. Something you can speak with your team about. And then after you utilize the pump, and the regimen that is specifically designed for you, then while you're in bed, try and do some range of motion exercises, try and get the leg moving, try and do some breathing while you're in the pump. I mean, if you can't get your garment on, you're going to have to do something. And I think a pump is absolutely appropriate.
Well, we love that answer. And we encourage anybody out there, if you're interested in finding out more, we will connect you with a local compression therapy consultant that will help you connect with getting the documentation. We'll work with your insurance. We say that LymphaPress is the therapy that's easy to live with, because if it's hard to use, you're not going to use it. But this is super easy to use and people see wonderful results. So let's move on to Jane Young for diaphragm breathing. And I think you alluded to this at the very beginning, but let's say it again. Should you be laying down, sitting, or standing?
Diaphragm breathing is something you can do in any position. And I encourage people, once you've learned how, to make sure you can do it while you're lying down, while you're sitting at your desk, while you're active throughout the day. But if you are just starting and you've never done diaphragm breathing before, I think it's best to start laying down, just in case you get that dizziness. You have the support of the bed or the mat or the table that you're on. And then if you get up and you're feeling a little bit dizzy, you can easily lay back down, go to regular breathing for a few minutes until that dizziness subsides.
Excellent. I think that's a great answer. And Hannah follows up and says, for some people, they need to be sitting on the toilet while doing it.
Okay.
Okay.
I think that's,
hey,
you know, as long as they're not holding their breath, then that's okay.
Whatever it works. Okay. Katie Taylor wants to know, should exercise or breathing exercises be performed before or after pneumatic compression, or during? I have to ask too.
I would say definitely as you start, and depending on the kind of pneumatic compression you have, I'll sometimes give my patients a pre-pump self-massage routine that includes diaphragm breathing, that includes opening up or activating the lymph nodes in other areas. So I'll have them do some deep breathing at the onset for sure. And then usually, especially if they get it and they like it and they understand the concept of diaphragm breathing, I'll have them do it at the end, during, throughout the day. You can't overdo diaphragm breathing unless you're getting dizzy.
We have had so many people just say, thank you, thank you, thank you, thank you in chat. And Lisa, I also love that you mentioned that September is Gynecological Cancer Awareness Month. I've been really burdened about this because there is so much, and rightfully so, information and awareness about breast cancer and the connection with lymphedema. But a startling number of patients with gynecological cancers suffer from lymphedema as well. And we want to help them. What
Yes.
can we do to connect the dots there?
I think the more we talk about it and the more we bring it up, because it's not even just females with gynecological cancers, it's men with prostate cancers, it's colorectal cancers. There are so many other types of cancers. Melanoma surgery often requires the removal of lymph nodes that can cause a lymphedema. So I'm thrilled that breast cancer awareness has really raised our knowledge level overall of lymphedema. But the more we talk about it, the more we get the word out about the other types of cancers and other types of lymphedemas and lipidemas that there are, the more people will start hearing it and start asking the right questions and helping us spread the word.
So there is a clamoring for your slides. Now, we always provide the people that have registered with a link to the replay once we have it all cleaned up and edited with graphics. Are we permitted to provide your slides? You are certainly able to say no, or we can just...
I don't often like giving out all of my information, but if people want to reach out to me and get pictures of the diaphragm and the diaphragm breathing, I'm happy to pass those along. But again, it is recorded. You have access to all of that.
Yes. Jackie Ferrer wants to know, can we get a recording? And absolutely, everyone who registers, once we have the video edited with graphics and all of that, everybody who registered will get a link to the replay. And of course, it will be posted on lymphapress.com and our YouTube channel. So we want to make sure that you can watch it again, because this was so chock full of information, and we've already imposed on enough of your time here, Lisa. Can we promise to have you back, though?
I would love to. I would love to.
Good. We would love to have you. Any final words for our audience? Because we still have a good number of people that have stayed logged on throughout the Q&A. Anything you'd like to leave our viewers with tonight?
I mean, my final words are just start. Just start. It could be that 2 minutes around the house. It could be lifting a water bottle up and over your head. You don't even need the water bottle, just intentional movement. Diaphragm breathing. Now that you understand, I just want you to start moving. I am open to questions, but I am not your medical team. So if I'm not your medical team, I'm not going to give you specific advice, but figure out what you want to do and start there. Just start
somewhere. Start slow, start somewhere, listen to your body and move. Thank you, Lisa Sylvestri. You are amazing. I'm so grateful to my friend Kathleen Lisson for recommending you. I know we'll work together in the future as well. And thank you to all of you who took the time out of your evening to be with us, to learn more, to be inspired and encouraged to manage your lymphedema. We at LymphaPress truly care. We would be honored to help you in any way possible. Even if it's just to bring you excellent information like this, let us know what you want to know about, and we'll do a webinar about it. Everyone have a great night. And again, thank you, Lisa Sylvestri. You were amazing. See y'all.
Thank you, Brenda, and thank you all of you as well.
Bye.